My name is Rosemary Brown. I'm the Chief Nursing Officer at Duke Raleigh Hospital. At Duke Raleigh, we are committed to partnering with our patients and their families in their care. One important way we partner with our patients and families is through bedside reporting. Bedside reporting means that the two nurses, the outgoing and oncoming nurse, come to the bedside of the patient and give report. And they include the patient and the family if desired. Evidence indicates that bedside shift reporting improves quality of care, patient satisfaction, patient safety, accountability between nurses, and time management. We are implementing bedside shift reporting on all inpatient units at Duke Raleigh Hospital. There are 4 key steps to bedside shift reporting.
Step 1, prepare the patient on admission.
Mr. Blue, now that I've finished your admission, I want to let you know that our hospital conducts bedside shift report every morning and every evening around 7. The nurse going off duty and the nurse coming on duty will come into your room and discuss your situation. We'll discuss your plan of care, and we'd really like it if you participate. We'll also ask that if you have any family members or any visitors, that you will allow them to step out at that time, but if you want them to stay, that's just fine, okay?
Step 1, prepare the patient at the change of shift.
Mr. Blue, it's 6:15, and I want to remind you that the oncoming nurse and I will be conducting bedside shift report around 7. Do you need anything for pain at this time?
No, I'm good.
Okay. Well, here's your call bell. And remember, we don't want you to get up by yourself because we really want to keep you safe. And we do want you to call if you need any assistance. Why don't we go into the bathroom now?
Step 2, introductions.
Hello, Mrs. White. This is Melody. She's going to be your nurse today, and she's going to take very good care of you. We're going to log on to the computer so we can look at your chart while we give report, and let us know if there's any questions you have. But to get us started, we need to check your name and birth date. Could you please state your name and birth date?
Mary White, and November 13th, 1946.
Great.
Okay, and that's what your name band says too. Good.
Step 3, the bedside report. The bedside report will use the SBAR format, beginning with the patient's situation, a brief description of why they are in the hospital, then the background or patient's pertinent history. The assessment information is shared. The nurses review the flow sheet, focusing on important results based on the type of patient. For example, a surgical patient review would include ambulation, 24-hour urine output, and tube drainage, and focus on abnormal findings such as vital signs, skin problems, or lab results. Safety checks are also completed at this time. This is a visual check of tubes, lines, dressings, emergency equipment in the room, and IV fluids. And finally, the report concludes with a review of the goals for the day. At this time, the whiteboard is updated and the patient is included in goal setting. Step 4, the last step in bedside report. After the nurses complete their verbal bedside report, they will review the EMR and address any pinks, and then move to the nurses' station to complete a quick chart check for order completion and any new orders. Now that we have reviewed the steps, let's see this all together in the following scenarios. Scenario number 1, bedside report at the change of shift.
Hello, Mrs. Green. This is Melody. She's your nurse for day shift today, and she's going to be take good care of you.
Hello, Melody. Hi. Nice to meet you.
We're going to be doing bedside report, and that means we'll be going over your information, including your plan of care.
Can you tell me your name and birth date, just to start off, and I'll check your name in.
My name's Pam Green and my birthday's June 30th, 1951.
Great.
Sir, would you please step out for a few minutes while we complete our bedside report?
Actually, I'd like my husband to stay.
Oh, great, that's fine.
Okay.
Alright.
Mrs. Green is a 60-year-old female admitted last night with pneumonia. She came to the ED yesterday complaining of cough, fever, dizziness, and chest discomfort. She is a healthy 60-year-old who has a history of right knee replacement 5 years ago. She has a history of hypertension for which she takes low pressor. Mrs. Green lives at home with her husband. She has no allergies, is on a regular diet, and is not on isolation. She is at high risk for falls due to her dizziness.
Okay.
We changed her IV antibiotics to oral, which she is tolerating well. Mrs. Green's assessment is within normal limits, except for some mild shortness of breath and wheezing. As you can see, her vital signs are stable. Her oxygen saturation is 98% on 1 liter. Her intake and output is adequate, and she's been comfortable during my shift. Around 5:30, I gave her 2 Tylenol for minor pain with good results. And she has an 18 gauge in her left arm,
Okay.
and she's got normal saline at 50 miles per hour.
Alright. I'm just gonna do the safety checks now. I'm just gonna check your IV site here. That looks good, and it's patent. Is it having any pain at all?
Yep,
No? Alright. The emergency equipment is here. Your IV site looks good. It's due to be changed in 3 days. That's good. Bed is locked. It's in a low position. And I just need to check and make sure you've got your yellow socks on. You stick a foot out. Perfect. Thank you very much. Mrs. Green, today our plan of care is going to include getting you ready for discharge, which means discontinuing your oxygen, get you up walking around, cough, deep breathe exercises, using units in a spirometer, and getting a follow-up chest x-ray. Does that sound okay to you?
Mm-hmm.
Yeah? Alright. Do you have any questions about that?
What kind of medications will I be taking when I go home?
Okay.
The doctor's gonna write for any prescriptions that you'll need when you go home, and we'll make sure you understand your medications, the dosage, and the side effects.
Okay, thanks.
Alright. Now that we all know that, I'm just going to update the whiteboard so that we're all on the same page. Okay.
Now for a few special situations that you might encounter. Scenario number 2, plan of care, discharge.
Mr. Brown, do you have any questions before we review your plan of care for today?
My doctor said I'm going home today.
Well, the doctor has not written the order yet, but it does look like you're ready for discharge. So while we're waiting for the physician to do his paperwork and get you ready, we'll certainly help get you ready for home. We will work on your plan of care, get you up walking, make sure you can take your oral antibiotics, and also give you a pneumonia vaccination. Now, you may also want to let your family know. If once this all gets completed and we can get you ready for home, this whole discharge process will take about 2 hours. So this will include also educating you about any medications and your home care.
Okay, thank you.
Scenario number 3, the patient with concerns.
So the plan of care today for Mr. Mustard is to get him out of bed.
That's right.
That's all fine and dandy, but I haven't seen my doctor. It's been 2 days. The bathroom is nasty. I haven't eaten. And I haven't even had a bath.
I'm sorry to hear about your concerns, but my plan will be to address all of your concerns today. Let's finish your safety checks, and then we're going to step out and finish report, and I'll be right back to check on you.
Fine.
Scenario number 4, the very friendly, talkative patient.
Mrs. Peacock is a 70-year-old who was admitted with
Hi, how are you all today? Don't you just look darling and adorable in your blue? Do other people wear dark gray or black or what color? I see that you all are nurses. You know, I have a niece that is a nurse at ECU, and she just loves it
Mrs.
there.
Peacock, we are so looking forward to spending more time with you today, and I look forward to hearing more about your niece. But right now, we want to finish our report, and to complete our plan of care. It is for your safety, and then I'll be back in a little while, just in a few minutes, and we can finish, and you can tell me about your nurse niece at ECU.
Oh, well, okay. Okay.
Now that you have seen examples of bedside shift report, I want you to review the handouts that you've all received. There's some additional questions and answers, and special situations that we didn't cover, such as the forensic patient, or patients who are sleeping when you try to give report. I want to be clear that bedside shift reporting is the key to our success as nurses in caring for our patients, their loved ones, and each other. Thank you.
Yep.
Okay. Hi there, I'm Marianne Fuchs, and I serve as the chief nurse for Duke University Health System. And I just want to congratulate the nurses at Duke Raleigh Hospital for implementing and embracing Bedside Shift Report. Bedside Shift Report exemplifies the values of caring and collaboration and the foundations of professionalism and innovation in our professional practice model at Duke. Thank you for being leaders in the organization and providing excellent patient care. You truly exemplify the values of our organization, caring for our patients, their families, and one another, and as well, truly embracing the principles of patient and family-centered care. So thank you, congratulations, and I look forward to your success as an organization with Bedside Report.